Okay. Hello, hello. We're going to start in a few minutes once people come in. I'm really excited today on Repro Empowerment's last Thursday in this month of May. We are talking about trauma responsive reproductive health with Parijat Deshpande, and we will get started in a few minutes.
Yep.
Okay. Perfect. I was just checking on the app to be sure that it was going live on LinkedIn, and it is, which is great. Okay, I say that we should just go ahead and get going. Hello, all, anyone who is watching now on LinkedIn Live, anyone watching the recording later. This is Lindsay Nelson with the founder of Repro Empowerment, and I have with me.
Parijat Deshpande.
And we are talking today on our last Thursday webinar for May 2024 about trauma responsive reproductive health. I just realized I have my music still going. Let me turn that off. So I am really honored to have Parijat here with me. I have followed your work for quite some time, learned a lot from you. We are going to get into talking and learning a lot from Parijat today. First, as we always do, we want to just come into our body and be present. So feel free. I usually have the slide up that just reminds you that this is for you and you need to do what's best for you. You know what's best for you. So if that means watching some, stepping away, knowing that something may trigger you, taking care of yourself, if it makes you feel that you need to do some movement, drink some water, journal, feel free to do what is best for you during this. And with that, I am going to start us all by taking some deep breaths. You can't see, but I'm going to put personally my hand on my chest and my belly. You can do whatever makes you feel comfortable to you, whether it's closing your eyes or not. I'm going to close my eyes and take a few deep breaths. I'm gonna count them, and I'm gonna breathe in to the count of 4. I'm gonna hold for 4, and then I'm gonna release 1, 2, 3, 4. I'm gonna do that 3 more times. In, hold, 1 more time. In to the count of 4, and hold, and out. I know that whenever I do these, I'm nervous. I could feel my heart racing and slowing down with my breath. Know that I need to come present. So I am feeling my hand on my chest. I'm hearing the sounds around me. I'm choosing to be here and leave the stress of the day outside so that I can learn and grow and that I can listen to what my body is telling me it needs. I'm going to slowly open my eyes. I am here with you guys. Thank you for grounding with me today. That is just one of the very simple exercises that I do to come into my body to calm my heart rate. And it is a good example of the expertise of Parijat, which we'll go into in somatics. Um, Without further ado, I want to introduce her. I'm going to put up some slides about her. If you're okay with it, I'm gonna introduce you and then let you talk about yourself and put the slides in.
Sure.
Yeah.
Yeah.
Okay, so Parja is with us today. Like I said, I have followed her work for a few years now. I'm very honored that she took time amidst a really amazing launch we'll talk later about. She is the author of the bestseller Pregnancy Brain, which we'll talk about, and the Body Language Journal. She is a somatic trauma professional. As you guys remember, a few months ago, we brought on Leslie Humbert, who was a somatic professional in doing somatic therapy through dance. So Parijat is a somatic professional in specializing in stress physiology and high-risk pregnancy outcomes. She's the founder of the incredible company and movement of Ruvel. It's the only truly trauma-informed company dedicated to improving high-risk pregnancy outcomes and ending prematurity as parents can pass on generational health. Without ado, I'm gonna go ahead and let you talk. I'll go ahead and put this next slide up.
Amazing. Thank you so much for having me here, Lindsay. It's an honor for me too to be here with you and your community. Hi, everyone. I'm Parijat again. Um, you know, I I know we're going to get into this a little bit, but I do this work because of my personal lived experience, and I know Lindsay and I have talked about how much lived experience influences so many people like us who are in this world doing this work. And so I created Ruvel as a way to actually fill in the missing pieces in reproductive and prenatal healthcare. And to be honest, I didn't know that there were missing pieces in reproductive or prenatal healthcare until I was the patient in reproductive and prenatal health, receiving that healthcare. And it was really from that again, that lived experience to go, there are massive gaps in our medical system and our mental health system in order to support people like me who are going through infertility, going through losses, going through very high risk pregnancy, going through the NICU, and then parenting this tiny little person once they come home. And so, I wanted to create something that was really the change maker for reproductive and perinatal healthcare, which is bringing in the intersectionality of stress physiology and health outcomes and doing it from a trauma informed lens. And that there's a lot of big buzzwords that I just threw out there. And so, what that really means is stress physiology, meaning we move away from the outdated notion of stress being a thought based issue. And we really look at what's happening physiologically in our bodies when we have activated threat cycles. And I know we're going to go into all of that later. Where and how does that intersect with what happens in our bodies, our specifically our nervous system, our endocrine system, and our immune systems, in order to, in a way that affects positively or negatively, reproductive health and pregnancy health, and ultimately pregnancy outcomes. And the intersectionality of those two with how do we do this from a trauma informed lens? Because it was truly through my personal experience of going through it where I recognized how many different points of the process did I experience medical traumas. And how did that possibly add an added layer to, or a factor into what happened and what my experience was health wise? And so that's really what Revel does. It's founded on the basis that sustainable improvements to high risk pregnancy and fetal outcomes requires really four basic things, right? We have a lot of companies that are dedicated to improving access through healthcare, but we need to have trauma-informed healthcare. And so this is something that we do at Revel, is bringing in other companies and providers and practitioners who we know are at the very least trauma-sensitive and trauma-responsive, if not trauma-informed. We'll go over the differences of that in a little bit. But we need to have access to trauma-informed healthcare. We need to have access to stress physiology support as a standard part of prenatal care. That needs to be built into the system. And that does not mean you just get a referral to a therapist. That's not the same thing, right? We need the physiology of stress to be addressed in regular and standard prenatal care and standard reproductive health care. We need a depathologized approach to health and wellness, which means it's not just about what's wrong and how do we fix it, but really looking at what's happening and why, and how does it make sense given what you have already been through. And then we need to be able to have a sense of belongingness in an inclusive, wellness-focused community, as opposed to a community that maybe does a lot of trauma dumping or a lot of oversharing without a lot of boundaries, but also a sense of belongingness where we can actually focus on wellness. And by wellness, I don't mean, the wellness fads on social media. What I really mean is feeling well and looking at what are the factors in our life and in our health and in our communities that can help us move towards wellness. What's working and how do we do more of that? And that sense of belongingness is so important because social engagement is a tremendous part of being able to recover from medical traumas, is really re-engaging socially with people around us, safe people around us. Who are they? Where they come from? And how can we do that in a way that is matching, again, our physiology? So that's what Revel is all about. It's based on those four pillars. I'm very excited about it. I'm so happy to be here sharing with you about that.
Yes, I am very excited about what you're doing. And let's see. Let me see if there's one more slide. Um,
And I guess just to kind of hit home why we're focused specifically in this community, it's that when I was going through it myself, high risk pregnancy was, and it still is, kind of a footnote. It's like when you look at pregnancy advice, you look at pregnancy materials, you look at anything related to do with pregnancy, it is all centered around low risk pregnancies. Now, that makes sense because most pregnancies will end up being low risk. But high risk pregnancies are not actually that unusual. It's up to 30% of pregnancies worldwide end up being high risk, and that number is increasing for a variety of different factors. And I got tired, honestly, of being the footnote, being the shoved in the corner, like we'll deal with you later. And I also got tired of the experience that people have going through high risk pregnancies, where the minute the pregnancy becomes high risk, and sometimes that's before pregnancy, you know that your next pregnancy will be high risk, or in the middle of the pregnancy, something comes up, it becomes suddenly very clinical and you lose that personal experience of what that should be. And that never ever sat right with me. And so I really do personally believe that high risk pregnancies deserve to have a spot on center stage. They should not be a side note, a footnote, something that we get to later or something that's too hard to talk about. They're real. And I think there's also a lot of hope built into the high risk pregnancy world. And I don't want to overlook that, you know? So that in combination with really understanding the science, the physiology, and the research behind trauma-informed and stress physiology approaches to health and how much they can actually help with improving outcomes. It was really important to me that we have a place where people who are on this complicated journey can come to for actionable solutions on what they can actually do for their bodies to help themselves get pregnant, stay pregnant, and then pass on that generational health. I mean, I think that's so important. We don't just focus, the medical system is built on these kind of siloed places and experiences, right? You go to the fertility clinic to get pregnant, and then they send you over to OB, and then they help you stay pregnant. And then in my case, then they sent us over to the NICU and they helped us keep the baby alive, and then they kicked us out. They were very nice about it. They're very lovely people. But there's the through line in all of that is you as a human being and your lived experience of that. And there needs to be a place where we can have room for what is that experience and how can you affect that experience to stack the deck in your favor. And both of those things combined is exactly why Ruvella is so needed in this world and why Ruvella exists today. We are here filling in those gaps that nobody else is doing. It's not even for the high risk pregnancy community and for generations beyond. I think that's just so important, that we keep that connection all the way through. And I'm very excited to bring Ruvell into the world and for you to have access to it.
Yeah. Um, Absolutely. I agree with everything you said. It's fantastic. And we'll go more into it with some of the questions I have to ask you. But do you want to talk now or later about kind of your launch and the community and membership?
Oh, I'm fine either way. Do you want me to get into it now or should we?
Sure. Let's do
Okay.
it.
So Ruvel does all of these things in two ways. One is we have a shop where you can access a lot of our products. And then we have our private members club where you can access uh, guidance in a variety of different ways, whether it's going into our somatic meditation room and learning what actually real somatic practices are. And I'll give you a hint, they're really, really slow and they're very, very simple. That does not mean that they're easy, but that's really how the foundational work actually begins. We have an opportunity to gather in our gathering place for mixers. We have classes on demand and live classes and master classes, deep dives into specific topics related to stress physiology and a bunch of different aspects of stress physiology as it affects reproductive health, perinatal health, and parenting even. So that's kind of the place that I imagine people will just come as this is where I belong. I imagine it as a home base for all of us who are fighting on this journey to get pregnant, stay pregnant, bring our babies home, and then raise them in this wild world that we're living in right now. And so those are kind of the two parts of Ruvel essentially. And, our shop is there. If you're new to Ruvel, it's a great place to dip your foot in, kind of take a taster of the type of support that we offer, the kind of approaches that we offer, how it might make sense to you and your health journey and wherever you are on that. We have a wide variety of products in that shop as well. So we want to give you choice. And so the whole option here on both levels, both in the shop as well as in our private members club, you will always have an opportunity to choose what makes sense. What do you need today? How would you most benefit from being helped in this moment, and giving you the opportunity to practice having that agency and choosing for yourself.
Amazing. And you've been working so hard on this. That member space is so incredible. I love that it's virtual, but it's very much set up as like a tangible like building with different rooms for
Yes.
the different things. Yeah, a presence, I guess. That's what I was probably trying to say.
Oh, I love
So,
that word. I haven't thought of it that way, but yes, that's exactly it.
okay. So that's that. So we'll bring it up again at the end. Yeah, get that away just so, okay, perfect. Wonderful. Okay, so I'm sure that some of the things that I plan to ask you definitely have got started to go over them, and I'll try to tie it back in. But yeah, so do you want to start out? You alluded to it, but do you, I don't know if it's comfortable for you to start out or to do it later in how you got into this line of work and your personal story
Sure.
of finding it.
Yeah, it really was my personal journey through it. My background is in clinical psychology, and I'd always wanted to do something in reproductive health, but it just didn't quite click how to get there. I thought I'd be an OBGYN, and then I took chemistry in college and I went, that's not the way we're going to do this. So I didn't know how I was going to get there. And it was my personal experience, truly, of going through fertility treatments and losses and a very high risk pregnancy. Um, my son was born at 24 weeks and 5 days. So we had a lengthy NICU stay. And it was really like that whole experience, and then the challenges of trying to have more children after that and the losses that came with that, that
Mhm.
really showed me what was missing, and I think one of the things that really stood out to me, I talk a little bit about this in Pregnancy Brain, is there was a moment when I realized that I didn't want to be go through my pregnancy so anxious. I was terrified of losing this child. I'd already lost one before that pregnancy. I didn't want to lose that another one. And I also knew that I didn't want my stress to affect my pregnancy, but I didn't know what to do at that point because my
Yeah.
training is based in traditional clinical psychology
Yeah.
methodologies. And as the patient now, I was looking at everything that I knew and I went, I don't think I would need any of this. I want somebody to help
Mm.
me know how to protect my pregnancy and protect my health and protect my baby from feeling this anxiety that I'm feeling or this fear that I'm feeling. But also, I also want somebody to acknowledge that this fear makes sense. How could I not be scared when I'd already lost one child? And I think that's a big piece of the work that I do. So a lot of Ruvel is based off of my private client work that I just kind of pulled, like what were the big things that we'd work on together and pulled it together so that it's now accessible to everybody. One of the big things, and we talked about this in that little flower, is we've got to depathologize the experience. There's nothing wrong. There's nothing to fix when you're feeling anxious or scared. And the difference between the two is also in Pregnancy Brain. But we want to really ask a different and I think a better question, which is not what's wrong, but how does this make sense? And I think when we approach it from that perspective, we suddenly have very different answers. I think more actionable
Mm.
answers that we can do something with.
Absolutely. Yeah. And yeah, what a journey. And it is really true what you're saying to bring us, the fact that we even have met, which we kind of met through like because you had already gone through like kind of your entrepreneur journey to bring this story. And then I was like, I need to do this full time. And that's how we connected. And both of the like we wouldn't have been there without those experience and it wouldn't really makes sense. I love what you're saying about, the, what we talked about this in my last month in kind of the body keeps the score and really that, traditional talk therapy is like the top down stuff. We have the meds and then somatics is bottom up, right? And so like you need a combination and for different things, you need understanding and different ones. And so that's what I've been trying to bring to the community is kind of the bottom up approach to complement, that. So that's beautiful. Um, the next question you already answered. It was like, how does your background in the psychology and personal experience tie into your current line of works, which we talked about it. You talk quite a bit about the power of the body. What does that mean? How do we harness the power of our bodies?
I think the simplest way to say it is that when we're talking about chronic or traumatic stress, the memories of what we've been through don't just reside in our minds. And in
Mm,
fact, there are many
mm,
things that we go through that our brain doesn't hold on to for a variety of different reasons, but our body always will. And I think this is
yep.
something that I'm really specifically fascinated by with medical trauma is it's a type of trauma where it's basically something it's like a think of it like a lightning bolt, right? Like there's something that's too much, too fast, too soon in your body. Like it's more than your somatic capacity can do anything with. And that can be tied to surgeries, it can be tied to fertility treatments, it can be tied to pregnancy complications, birth trauma. There's no definition of what medical trauma is. It is how your body has encoded that experience. And I think what I find so fascinating about that is even when you can't remember up here, your body is always replaying that same experience until we can complete the threat cycle, essentially. Um, and that's what traumatic stress really is, and that's what chronic stress really is. When we talk about stress physiology, we're talking about completing the threat cycle physiologically in your body. And I just find it so fascinating that when we can do body first, especially for things like medical trauma, we get a much better understanding of what happened before, even if you don't
Mm,
remember what happened before, because it's happening right now. And I think when we go into the body first, there's a much gentler way of understanding not only what's happening, but what we can do about it versus going, like you mentioned, top down. There's a pull to try to make sense of things. There's a pull to try to make meaning of something that very often is meaningless, right? There's not necessarily a meaning to why I lost this child or why this baby came too soon or why they developed these complications or I did or whatever. And so I think that when I say the harnessing the power of the body, I really think what I mean by that is we listen. We listen and we
mm,
let the body tell the story. And that's through how our senses work. All eight of our senses are giving clues. It's how we hold our bodies, it's how we move our bodies, it's the patterns that our body falls into when we are tired versus when we're stressed versus when we're scared versus when we're hungry. There's I just find it so fascinating because it's so simple. It's like, and maybe this is why I like it so much because it reminds me a lot of when I was back in my clinical days. I used to work with children. I was a child
mhm.
and family therapist, and it was just with children. It's just so simple. There's no big filters and like all these things that have jaded them. It's just so simple. Like I'm angry and that's why I hit this kid. Like okay, we can now do something with that. And I think that's kind of the same thing with somatic work. And my specific specialty, as we talked about, is stress physiology and pregnancy outcomes through a sensory and sensory motor lens. I know you mentioned you had a guest on who did dance, I believe, right? That's a different kind of somatic approach. Mine is a little bit different too. There's so many different kinds, but I just love it because you get to the answer faster. And as somebody who's not a very patient person, I really, really like that.
Yeah, absolutely. Um, yeah, I love that, and, if you don't mind, it just so ties into something kind of why I started Repro Empowerment is that, and kind of the journey of it is that, as anybody who's watching has watched any of my former things, I won't go into my personal story because they've seen it, but essentially that through that trauma, of the sexual assaults, of quite many medical traumas. Some of them on their own, the trauma, and some of them were, retriggering past things. Then I met someone who was trauma informed as a provider, and I had been trauma informed in a different setting. And she asked me something that I had said many times to another person was like, "Do you have questions, about something else that happened before we start this?" So it's creating space and then expressing that, like, I noticed that you're upset. Would you like space or would you like me to, uh, touch you, hold your hand, or give you a hug. And that was like, so what I had done many times with survivors. And, so we're at the courthouse and we're seeing that. And I see that you're feeling something. I don't want to put a word on it, but you're expressing some emotions. You know best. Does that mean space? Does that mean being closer? Does that mean holding your hand, giving you a hug? And then before that, do I have permission to touch you? And I've used that kind of as a line. And the reason that I bring this in, trying to make the long story short, is I found like, oh, I deserve that in my medical treatment. I deserve to not be re-triggered constantly. People who are not intending to re-trigger me, right? But going, oh, that's what I need. So now I can bring it and create this framework for other doctors. When I see them, I go, this is what I do if I'm triggered. It's very obvious. I get very loud or very quiet, like, so I can tell them, you don't have to have known me. Like I know
Yeah.
what it is. This is what works for me. And so in doing that, I chose to freeze my eggs. And that's how I started to repro empowerment, because I found a lot of healing through that process. And two reasons being is, uh, I had finally found a positive way that I could go to it, like a visit like that. That was the first provider that I wasn't in pain for any, for like in extreme extreme pain, is that I had, these sensitivities. I just didn't feel safe. So my body was like, not safe, not safe, not safe, shut down. So, anyways, all that to say is I went, wow, this is really a positive experience. It doesn't mean like I like it, I'm
Yeah.
never like looking forward to, my annual exam or my pap smear or my colposcopy, but was like, oh no, if my body knows it is safe, it's something it doesn't want to, but it's safe, then it's a very different experience. And so I said, I kind of practiced that with a new doctor because inevitably that doctor went to somewhere else. And then I was like, well, I've been wanting to figure out what I want with my fertility. I don't know, but I know that I don't want to lose the option. So when I did it, I practiced that same framework, and the way that my body healed is that instead of now using that and practicing that, going like twice a year for my abnormal paps, I then got 12 practices in like, 2 weeks or whatever, 3 weeks with these things of someone that I had deemed safe because I had set this thing, was clear. And then I got literally in the body to practice. Oh, this is what an exam looks like. Remember, you're safe with this person. And you're safe because you've asked for these things and things. So then I got essentially like the healing of like practicing and feeling in the body, feeling safe and going, I'm choosing to be here. I'm not under threat of an unwanted pregnancy or a lost pregnancy or possible cancer. That's those the only reasons I'd ever been for reproductive health. So I was there of my own volition, and I wanted to be there to do something that was taking power. So I was taking power of my reproductive health, and I was choosing to be in that chair, and the exam was going the way I wanted it to. And I got all of that instead of like, in years, I got that in a few weeks. So I walked out of there like, I can do any exams whenever, however, and I luckily got eggs out of it, and that I still have frozen. But I said, "Oh, that was worth it just to have done so much somatic healing, so much healing in my body, so much of the trauma, of the assaults and the medical trauma, like was released in that process. I even say like it was more bang for my buck than I like for all the therapy I had gone to. Like the
Yeah.
cost to freeze my eggs for one cycle was like well worth it, even if I hadn't gotten an egg out of it, which luckily I did. But so that is the long story that I was trying to bring in, like absolutely what you're saying of healing the trauma through the body. I had talked it out, and that was necessary so that I could actually verbalize, "Hey, this is what I need."
Mm.
And then I got what I needed for my body, and it felt like unlocking pieces that just like.
Yeah. It just clicks then, doesn't
And
it?
yeah, and I went back to this
Yeah.
doctor to do the pap smear, and I had literally said, because she was my first doctor after or provider, I should say, after the midwife that was trauma informed, and I had asked, because it was new and I was trying to practice my like autonomy and my voices. I said, I want an appointment just to meet you. I don't want to schedule
Mhm.
like something because it's probably going to be a colposcopy, all those things. Like, I just want to get comfortable with you.
Yeah.
And I'm in a privileged spot that I can pay an office copay for it, right? And like, I
Mhm.
happen to be insured right now, um, so I advocated for myself. I just want to meet the provider. I don't want to schedule anything. If I feel comfortable with them and we do a pap smear, great. They have the supplies on hand. So I had done that with her, and when I came, and that was before my egg freeze, and then I came back, and I was like, "Hey, what's up? How's your family?" Da da da. And she was like, "Okay, so just like you want, we're gonna walk through everything that we do. You're gonna
Mhm.
say what you want. I'm gonna do this, and then if we have time and you're ready for it, we'll do that." I'm like, "I'm ready. Let's go." And she was like, "What?" And I was like, "Yeah, I did it like 12 times last month. I'm good." Like,
Yeah, yeah.
and I was like relaxed, and I was like, "No pain," and I was like, "All right, so anyways," and she's like,
That's
"What
huge.
happened?" Because she like
That's
within 2 months, she was like, "I remember meeting you just because you wanted to sit in the same room as me,"
yes.
which is understandable based on my trauma. And so she's like, "Whatever you just did and whatever, like, trauma you released, you need to figure out how to, like, pass that on to other people." So,
That's
anyways,
huge.
that was a lot about me. I didn't mean to make it, but it was very much about, like, I very much agree with, like, the release in the body. Like, I needed the talk therapy to be able to get to say what I needed and find out what I needed, and then I needed very much the somatics and just the pure practice of going to a state provider, over and over, for a reason that I wanted to then, be able to move forward and bring this to other people.
Mhm. Yeah, that's life-changing when you have
Yeah.
those experiences, right?
Yeah, yeah.
Yeah.
And it was really incredible because my provider for the egg freezing was actually a male, and I would have never. I actually had some healing in that too. Like, I pushed myself, and I did it in my second language in Mexico in Spanish and stuff,
Mm,
and like somehow, like, I was just disconnected enough from that, like, or connected to the trauma in some way, like in a really positive way, that it restored like a lot of things, if that makes any sense.
yeah, totally it does.
Like, I
Totally
was
it does.
pushed out of my comfort zone, but it absolutely within, like, the guidelines that I needed, within, like, the bumpers that I needed. So, okay. Anyways, that is something that I think that drew me to your work, like, because of that experience. So,
Mhm.
um, how do you this is a big question. How do you define and what do we gain by taking a trauma-informed neurobiological approach to reproductive health?
Well, I think, the short answer is we fill the gaps that are just ever present in the medical and the mental health field. But I think before we dive any deeper into that, I think we should clarify what trauma informed really means, because I think there's a lot of practitioners and providers and peer supports that are using the phrase trauma informed. It's not actually trauma informed. And I think it's important for the consumers and the patients to know and be aware of that. So, to be trauma informed, you first have to be trauma aware. And by trauma aware, it's not that trauma can happen. I think we're all pretty much on the same page about that, that yes, trauma can happen, but it is understanding what trauma really is. And right now, I think this is where we stop. I think this is where most practitioners and providers aren't even trauma aware, because what we think of trauma usually is PTSD. We think about um, something that's happened that was really awful, right? And we don't know, a lot of practitioners and providers don't know the line between a negative experience, whether it's from childhood or like a medical trauma, and what actually a trauma is. So I think we need to be really mindful of who we're working with and what their level of awareness actually is. We need them to know and really understand what trauma physiology is and what happens in the body, what happens to the mind. Why is there's a reason why uh, there's a limit to what talk therapy can do. And I speak as somebody who was trained in that first and fully recognized the limitations of that as I was practicing that. But then also, then when I became the patient, we need to understand the order of how the body works and how threat cycles are activated and then deactivated. We need to understand what changes. And it's not just a nervous system thing, right? This is changing every single body system. And so when you're asking about like a neurobiological approach to reproductive health, that's really what this is. How does the change to the nervous system cascade into a change to the endocrine system and the immune system, which are two of the primary systems that then ultimately have an effect on reproductive and prenatal health? And then after becoming trauma aware, like really understanding all of that, which again, I will, it's an unpopular opinion, but I will stick with it. I think this is where we are really lacking in both the medical and the mental health field, is what trauma really is. After that, then we become trauma sensitive providers, practitioners, professionals. And that's being able to see what is being presented to you from the lens of this person has survived traumatic stress and is likely living in incomplete threat cycles. And that you can tell somebody's trauma sensitive because they ask different questions. They don't go and ask about what's wrong and how to fix it. This is really where we start to see that depathologizing aspect that Ruvel is so committed to start to really build itself, right? As we don't ask about what's wrong, how do we fix it, how do I make this go away? We ask completely different questions. How does this make sense? How does this tie to? It goes from taking a cross-section analysis of the moment and looking at it longitudinally and goes, how does this make sense in the story or the journey of your life and what you've been through and what you've survived and what you are continuing to survive right now? And then after that, we have trauma responsive care. And that's when we build in the practice of kind of the tenets of this trauma sensitive approach, but now we actually build it into our interactions with each other. And specifically, we focus on how do we make the person feel safe? I think your example of asking for what you needed and having a provider who heard that and then was able to implement that is a great example of how somebody can be a trauma responsive provider. But it's also about how can you give agency to the person that you're with? Where can they have choice? And how can you always lead with that sense of choice? Building trust, of course, and then always coming from a place of empowerment in the sense of looking at resilience factors that the person already has and how can we use those to help you with whatever is going on. And this is true if you're seeing, a cardiologist, if you're seeing an OB, if you're seeing a podiatrist, like it doesn't matter, right? A midwife, a doula, whatever. It's all applicable. And only once that is standard can we start to build in trauma-informed practices. And so you can see how many layers we have to go through to even get there. And by trauma-informed practices, what we're talking about is taking all of these elements and actually putting them into practice as your norm and your standard. And I think the way that Western medicine is built, that is not possible right now. And so if you have a trauma-informed provider, most likely they are trauma sensitive. And maybe if you're lucky, they're trauma responsive, but they're not actually trauma informed yet if they're working inside the Western medical system. Now, that's not a horrible thing because there's real limitations, right? Some people don't have access to training. Some people are working inside of a system that prevents that from even being possible. I have dreams, as I know you do, Lindsay, of like flipping that all on our head and making this better. I have hope and I have faith that it will be better. But I think it's important to review that because then to circle back to your question, what is the benefit of this is that we're supporting people both individually and within the context of their family and their community in a completely different way. I keep saying this, but really it starts with asking different questions. It starts with asking better questions. And it starts with understanding the body in a way that we have known for decades how it works, and yet we have not implemented into our day-to-day life. There's a lot of pull to change behavior, to change thoughts. And again, right, changing something is not trauma-informed, as we've talked about, and it's missing everything neck down, which is a large part of who we are in our experience. And so I think when we take that trauma informed, and what Ruvel does is adds that neurobiological piece of how does the nervous system affect the endocrine system and the immune system to affect reproductive and perinatal health. When we do both of those things, what we're really doing is plugging a big hole in the ship of reproductive health. No more water is getting out or in. There's no leaks in the boat, let's say. we're combining that with the advancements in Western medicine, technology, in health tech. Femtech is taking off in tremendous ways, but they're all missing this piece of it. And so when we do it all together, I think that's where the magic lies. I really do.
Boy. Oof, chills. I love it. Yeah, and I have noticed that, I think that you're, like, more strict on the definitions on trauma-informed, trauma-aware, trauma-sensitive. I've learned a lot from you on that, but you're also, like, more optimistic about the change too. So both things that I can then learn from you, like hold people to the fire, but also like hope that they can change. I'm usually like, if you can even do one thing, I'll be, like, I want you to do 10, but I'll give you one,
Yeah.
in the reality of, yeah, in the reality of our system. Question that is, we hadn't planned to ask you, but you said, and I get asked this a lot, is yes, there's a lot of providers and advocates and stuff that like want better questions, like they want scripts and stuff for better questions, and there's only a handful that I usually like have kind of like scripted. I think it's situational, but in the reality, like I said, that sometimes just flipping a wording on something, it like can at least get the buy-in to start somewhere. So I love your talk about that, and I'm curious when you're if you can talk a little bit more about that on the changing the questions.
Yeah, absolutely. I think that's one of my favorite parts about the work that I do and like the trainings that I do is how to ask better questions. And I mean, truthfully, to be very honest, I don't usually give scripts until we are fully on the same page that
Mm,
the audience is
mm,
trauma aware and is trauma
yeah,
sensitive, because
yeah.
otherwise, it's not you don't know how to use it appropriately, and you're unlikely to cause harm. I think when you switch the scripts a little bit, but you never know, right? And if you don't have the foundations in place, what's the point of building the roof when the walls are still not up, right? So,
Yeah.
very truthfully, like that's where
Yeah.
all of my trainings begin to make sure that we're on the same page. But
Yeah.
I think one of the tenets that I keep in mind when guiding people, and it's professionals, of course, but also patients directly, when we're questioning ourselves, is really starting with the question, how does this make sense? How does this make perfect sense? My head is hurting right
Mm,
now. How does that make perfect sense given what I've just been through? I'm avoiding driving on that freeway to drive by that hospital. How does that make perfect sense? I think the
mm,
core of true trauma informed work is knowing how to consistently depathologize every single aspect of
mm,
the experience, whether you're personally going through it, you're the professional who's guiding people through it, or both, is to get really good at retraining your brain away from the pathological questions. What is wrong with
mm,
me? Why am I broken? Hey, I've spent many years asking those
mm,
questions. I know I'm saying this with zero judgment, but it's like having a car stuck in the mud and the wheels are
yeah.
turning and you're just not getting anywhere. And I find that this is a lot more productive in that we stop and we go, okay, I don't like that my head's hurting. I don't like that I get anxious driving around on that freeway by that hospital. That's totally fair. And how do those things make perfect sense? And I specifically use the word perfect because it's not, oh, well, yeah, of course, because, my kid was in the NICU there and I don't want to see it. No, how does it make perfect
Mm,
sense? Like, how can you get to a point where you could
mm,
justify this to anyone walking down the street, to yourself primarily,
mm,
in such a way, it's such a compelling way that there's no question in your mind. Of course, I'm going to avoid that freeway because it's not just because my kid was in the NICU in that hospital. There's something else to it. For example, It could be I avoid that freeway driving by that hospital, and that makes perfect sense because the last time I drove there was the last time that I had hope that I would bring this baby home.
Mm,
That's a very different answer,
mm,
right? And look what
mm,
happens when you hear that.
mm,
Something changes. That's your clue
mm,
in to go, "Oh, oh, that door
mm,
just opened. That's a door I haven't opened before." Because until now, I've been going, "Why can't I get on that freeway? Why can't I just go there? Why is this still bothering me?" You feel that
mm.
clenchy kind of feeling
Yeah,
with those
yeah,
questions compared to, "Oh, oh, I hadn't thought of it that way before," right? And
mm,
and I that's where I would start. If you're willing and open to try a different question, start with that one. How does this make perfect sense?
mm. I love it. And I totally agree. And I didn't mean to put you on the spot. Maybe that was yeah, it's a question for myself because I get that a lot. And it's like, well, but, like, giving you just like giving you questions without the basis is
Yeah.
not helpful. So I appreciate, that validation, but also, yeah, I love that. How does that make perfect sense? Awesome. And yeah, and in that, it's like, oh, I lost my train of thought, so I'll just go to the next question. If I think of it, it will come back. Uh Okay, so you talked about some, and I would love to hear more about. You talked about your specialty in stress physiology. Can you tell us more about what that means and what that entails?
Totally. Um, I love it. I'll start with that. I just think I can nerd out about this for hours, so I'm gonna really try to
I
rein it in here.
No,
Um,
no, no. We have plenty of time.
I love I think it's very tied to what we were just talking about asking different questions. Stress physiology means we are understanding stress as a physiological chain reaction to a threat. It is not a thought, it is not an emotion. Those thoughts and emotions come after our body has already activated a threat cycle. The best way to explain that in pregnancy brain, I use the example of being chased by a bear, but an everyday example, because I don't think most of us are chased by bears regularly. Although where I live right now, there are coyotes, and that's been interesting to experience. Um, so,
And the trend right now about being like chased by a bear in the wood, actually,
yeah,
I feel like with everyone's like rather be chased by a bear than a man. But anyways.
exactly. Yeah, so maybe it's okay. But like, a more everyday example is if you're just walking down the street, even in your neighborhood, and you cross the street and you see a car coming a little too fast, and you can't tell if they're going to stop while before they get to you, right? There's a very predictable pattern that happens in your body that will change every single body system, and I cannot overstate that. It is every
Mm,
single one. This change happens outside of conscious awareness. If you stop to go, oh dear, that car is coming at me and I think it might hit me, by then it will have probably hit you, right? So, and I say I'm being facetious when I say it, but I'm also not, I really want to hit home like this is not activated by your thoughts because I get that question a lot. What did I do? What did I do to activate that threat cycle? And the answer is absolutely nothing. This is why I can sit here with complete confidence every time somebody asks me, how do you handle it when people blame themselves for their stress affecting their pregnancy? And I go, because they didn't choose it. It didn't happen by choice. It didn't happen with conscious awareness whatsoever because thoughts are too slow. They're physiologically too slow to get you out of a dangerous situation. So what happens instead is the car is coming, your body registers that threat of, and I'll put words to it, but essentially it's, oh no, this car is coming too fast. And then there's an internal assessment that happens that your body does in like faster than that snap, really,
yeah.
of how can I get out of this threat the fastest with the least amount of resources. Now, if you and I are walking down the street and you see that car and you're able-bodied, feeling healthy that day, your body might, I'm going to use the word choose, but it's not a thought-based choice, right? Your body may choose to run. But if I'm sitting next to you and I have a broken leg, that internal assessment's going to go, you can't run from this. What are you going to do? Right? And so my body will choose something different. Choose again. And we go into a very specific threat state. That threat state essentially means, how did my body change in order to survive that threat?
Yeah.
In the moment, we do see, if we were to actually, while you're running away from the car and I'm standing there maybe frozen from it or preparing to brace for being hit, if we had a blood pressure cuff, if we were checking our glucose levels, if we were, checking, if we had to connect to a heart monitor, we would see changes. We would see very concerning changes to our bodies, right? The temperature changes, blood flow changes, like digestion changes. If you
Yeah.
looked at a person in that moment, you would go, oh my God, this person has a lot of health problems. But in fact, what's happening is it's a transient state from recognizing and the activation of the threat cycle to every part of your body changing in order to get away from that threat as quickly as possible with as
Yeah.
minimal internal resources used. And then
Absolutely.
what happens is also very predictable after that, right? So let's say we both were able to run across the street and then we kind of make sure we're both okay. We do a little like, oh, okay, wow, whoa. Okay, and then we kind of connect and go, can you believe that person? Like they almost hit us. And we have this connection at that point. The way we come out of or deactivate that threat cycle is also outside of conscious awareness. And it is something that happens in a very predictable way for all mammals. So when I talk about stress physiology, it's that. It's that cycle is so predictable and it is so not your fault or your choice that I think it gives us a really cool opportunity to understand our bodies and what they're doing. So that when, say, a client of mine has what we typically call white coat syndrome, we can kind of map it on that cycle and we go, where are you here? And then you add in all the sensory aspects and the sensory motor stuff to it, like those layers. We taught bring in somatic memories and all of that. And we can actually get a really nice map of the pattern of what triggered it, what keeps you there, and what prevents you from being able to deactivate that cycle. Not by choice, but your body needs something that it's not getting. Or sometimes it's multiple somethings, right? That's what we end up doing. And I think when we talk about it from that perspective, it's a lot easier to understand why there is scientific truth to the fact that stress does affect fertility and pregnancy health. Because the changes that happen in your body in that split second with the car actually last for longer when you're dealing with chronic or traumatic stress. And then, as we know, even outside of pregnancy, it adds risk for cardiovascular disease, for autoimmune diseases, for inflammation, for digestive issues. The same is true for pregnancy and for fertility as well. We just don't understand it quite as well because it's a lot more complicated, but we do understand it enough to know that this needs to be a part of standard prenatal care.
100%. And I love how you describe it, and, like, talk about, like, getting nerdy on it. In my last presentation, we went into it and went into vagus nerve theory, and I, like, just love rereading, about it and how certain parts of the brain, like, shut down and shut off, and how certain parts of the brain, is making sense of it, and during trauma that the things that are supposed to be making sense can't are shut down, so then that's how that just yeah. Anyways, I love it. I could talk about that,
Me
all day
too.
long. And I love how, like, I'm definitely getting more, like, in the hypothalamus and all this stuff, and you're like, we're getting the more, like, much more understandable, sense of it, and I think that, what I love talking about is, like, all of those automatic responses that you're saying are based in amazing protective, like, self-protected systems w that are really good, that we would all be dead if like, we wouldn't
Yeah.
be, the human beings that we are without them, and they're really well-intentioned and getting that response and getting, kind of the the fire tower, the alarm system, all that stuff. And with trauma, then with your sympathetic and parasympathetic system, you can't come back down, or you can't see the danger anymore because you've either been up so much or you had to disassociate,
Yeah.
completely remove yourself and not feel it at all because you have to protect yourself. It's all very natural. And I love, like you say, it's not choice. It's all, um, and it was really validating going back over all of that studies to see like, oh, because even though I know this, I've taught this, I've learned this many times, I literally had to say out loud, like, okay, so when, you start breathing heavier, your body is ready to fight or flight. In order to do but the resources, the most important thing, then the body will shut down other things. We're trying to be efficient. It's very smart. It shuts down like the digestive stuff. All of my stress for me is stomach stuff. So
Mm,
therefore, now I said, when I now get a stomach ache, that could be not stress induced at all. I mean, not like not threat induced, I should say.
yeah,
I ate something, I ate too late, I took a meds
sure.
on the wrong time, just like a very natural response. Then it works back up and I'm like, something bad is gonna happen. Because
Yeah, right?
bad things happened and it shut down my stomach and I couldn't and I threw
Yes.
up, right? And
Yes.
so now I was like saying, well, I feel such a sense of dread lately, or like I'm really feeling this thing bad is gonna happen. And then
Mhm.
I vomit and I'm like, but it was because like it was reversed. Does that make
Yes.
any sense?
Yes, it does. I
And
mean, that's exactly it makes perfect sense because that's exactly why I love the sensory approach to somatic memories is you have these internal sensations that are tied to memories. And by memories, I
yeah,
mean somatic memories. Your body
yeah,
remembers a time when your stomach was hurting and something bad happened, or something bad happened and then your stomach started hurting. And then now it's that connection has been made. It's the same
yeah,
way that we have those moments where you walk in a kitchen somewhere and you smell something and it just instantly transports you back to this wonderful memory or this restaurant that you went through. You're like, oh,
yeah,
what is that? It's
yeah,
the same thing. And I
yeah.
love that you brought that up because it again shows like you don't have to remember it in your head for your body
No,
to
no, no.
remember. And I think in the world that I work in with high risk pregnancies and birth trauma and medical trauma, there's a lot that we don't remember. I mean, sometimes it's because you were anesthetized because you were going through a procedure, so you can't remember. Or there's other moments that you were maybe awake and lucid for, but your brain just did not integrate those cognitive memories at that time because of whatever was happening. And I hear from a lot of people going, okay, but how do I do that? Like, I don't remember. How do I, is it possible to ever heal? And the answer is yes, always. It absolutely is because you don't have to remember in order to heal because your body's always,
Mhm.
it's playing it out regularly.
Yeah, and there's a very regular reason, a very like understandable. Again, I was just like going back over all of the stuff that had learned, but somehow sometimes just one day you read it, something
Yeah.
different, it comes
Yeah.
out, and so I was prepping, and it was like, oh, well, based on like the physiology, and this is so true of like why you can't explain something, or you don't like that, or you see an image but not the words, or things don't match up. It was like, oh, and then during trauma, the left part of the brain shuts down, or certain parts shut down, and they're the one that makes sense of something by relating it to something
Yep.
else. They're
Yeah.
the one that gives you the ability to speak. So you're like, how can I not be able to explain what happened? It's like because like the imaging is coming in,
Yeah.
but then it's not being processed by the part that
That's
processes
right.
it and puts it in a
That's right.
time reference. Why do I feel like I'm right there in the moment and it happened 20 years ago? Because the part of your brain that puts things in order was shut down,
That's right.
out of a again, out of what's the most important danger, right? Like a
Yeah.
natural response to it. And I was like, oh, even though I knew this, I feel so validated. It's like when I can't describe things or I can't remember, but something, and you're like, how can I remember this image, but not what happened 2 minutes ago when when I wasn't in trauma and I just set my pen down somewhere.
Right.
because we can only keep 10% of the conscious, and the part that puts everything in sense, like had to be shut down to keep you alive, you know? Yeah, I love it. I could talk about this all day. So,
I know.
um, but yes, I love the validation, and really, and I've talked about many times, like for me, out of my like chronic PTSD, like that I felt so good the first time I was like, ooh, and then I started crying the first time I heard about all of the like standard, I should say standard, but the common chronic illnesses and pains that are seen in common with people who have had ongoing trauma, and and some of them had the like little hints of it in my childhood, and then they were like really flared up. But it
Yes.
has to do with those systems you're talking about. So my asthma, so like
Yeah.
my tight chest because I'm worried and my heart is racing because of a possible threat, then is like, oh, same thing. I'm having trouble breathing, but I don't know how much it is that my lungs are really having trouble getting air to it versus the tight chest was from that anxiety. And, both are 100% true, and they're not by choice, like you said. And so my asthma attack creates anxiety, or anxiety attack creates asthma. They're the same sensation. Um, and and I think and I'm really interested in what you're going to talk next. We want to make sure on time because we talk about gaslighting is, and I also talk in my trainings about that. Um, like there might be symptoms that they might have something medically like asthma, right? Or some, the provider doesn't necessarily have to be able to diagnose they have asthma, that the physiological things are happening, they're valid, and they still need treatment in addition to the somatics, right?
Yeah.
So we could have tight chest and stuff like that. We don't have to be able to say, well, I can diagnose you to have asthma for you to have the tight chest. You have the tight chest, you have the difficulty of breath, regardless, right? And we need to like acknowledge that.
Yeah.
And it's also very common to have chronic digestive system, issues, digestive issues like I have, asthma, anxiety ongoing, because those systems that were all turned on weren't turned off in the appropriate way, or weren't turned on at all, and can't be turned on in the healthy way. So
Yeah.
100% agree with that.
Yeah.
Love it. I'm looking, if anyone's watching wants to do questions, please put them in the comments, and we will start answering questions until I see any of that. I'm going to ask a few more questions and remind people how to be able to work with you. Okay, so we talked about that. Hmm. Yeah, you talked about this, and what would you say to the person who thinks their pregnancy loss or preterm delivery is their fault, or someone who thinks that an outcome is inevitable?
Yeah. I mean, naturally, I would say it's not, but I also recognize being the person that you could say that till you're blue in the face, and I won't believe you. And so I think what I typically like to do with my clients is, and a lot of this is pulled from my own personal experience of just like, what did I do wrong? Why is my body so broken? Um, we look a lot deeply, especially somatically. What are the sensations that you either get more of or you get to avoid when you are focused on blaming yourself?
Hmm.
And that's a hard question to answer if you are new to somatic work. So if you're sitting there and you're listening to that and you're going, I don't know, I have no idea. That's okay. That's okay. But that's ultimately what we want to get back to is those thoughts are keeping us in a specific threat state that's very familiar. And I think this is something that a lot of people aren't aware of until we talk about it. And I think it's another way to really depathologize the experience, which is our body will always choose familiar over what's good for us. And
Hmm.
so if the muscle of a threat response is the one that's flexed the most, and the most frequently, or the most recently, but most frequently. And so what I mean by that is if the birth trauma happened more recently, or if you haven't completed the threat cycle and it's been a year, 5 years, 10 years, 15 years, it doesn't matter. Or if something happened in childhood repeatedly, for example, right? These are just examples, but the more flex you have using that muscle, you are going to go back and use that muscle again and again and again. And so why, we really want to understand, how does it make sense? Again, that question keeps coming back. How does it make perfect sense that your thoughts are going there? Because what is it doing to your body? What are the sensations those thoughts are allowing you to access, and which ones are they avoiding? Because the reality is, no matter how much we say we want to heal, it's got to feel worth it. And by worth it, I mean the changes you have to make to be in a different body have to be worth the comfort of the familiar pain. And that's really what we focus our attention on. And so a lot of the work that I did, and why I love somatic work so much more than kind of my original training, is that it's, to me, you're going to have thoughts. You're going to have those thoughts. You're going to have a lot of thoughts. We're humans. We have lots of thoughts. And our job is not to control them or to change them. Our job is to get curious about them and say, what are these thoughts doing, and what physiological state are they coming from? That gives us kind of a shortcut in to go, where am I right now? And what does my body need to complete this cycle?
Oh, so many tidbits. Can't wait to watch this back and take notes. That's why I love recording, because I definitely cannot be like present, because like true listening cannot happen while you're waiting to expect the next thing. Or for me, I can't take notes and really.
Right.
Yeah, thank you. What great reframing. Um, What's an easy first step that individuals with a high-risk pregnancy can take to integrate some of your practices into everyday life?
Buy my book.
Yes.
Because it's all in
Thank
there.
you. Yes.
Get Pregnancy Brain. If you're not pregnant yet, get the Body Language Journal, because it's all in there. It's all the practices that we've talked about that are rooted in everything that we've talked about are all in there. I think the other thing that I would add that we didn't touch on is understand why you are considered high risk. Because I think that's another element that can influence the threat cycles that we don't talk enough about. Don't assume that your provider is going to share everything or has shared everything. Ask the questions. I always kind of guide my clients to go, by the time, we create question workflows for them to take to every appointment. So it's not just what you ask, but how you ask it and in what order. You want to leave every interaction with your provider knowing exactly what they know, so that there's no question in your mind, wait, what did they mean by that? Or why did they use that word? Or why did they measure it this way and not that way? All of those questions you deserve an answer to. And to get started, I think, is understanding, why are you considered high risk? What about my history makes me high risk? What about this particular diagnosis makes me high risk? And then what does high risk mean for my particular health or my pregnancy? Because it's going to mean very different things. I have worked with clients in the past where they had the exact same complications in their previous pregnancy. Like, you looked on paper and you had a checklist, it was the same complications that developed around the same gestational age in their previous pregnancy. But because each of them had a different health history, their next pregnancy, when we were working together, those previous complications meant something different. So somebody with preeclampsia in their previous pregnancy and had a pre-existing hypertension is going to have a different risk factor than somebody who developed preeclampsia in their previous pregnancy and does not have a history of hypertension. So you want to understand, like, what does this mean for me? What does this mean for my future pregnancy? And what does it mean specifically, given what I've been through, right? So you want to pull the conversation away from the generics, the statistics, to now, okay, apply to me. What makes this high risk for me? What does that mean for my pregnancy? What does that mean for my baby?
Yeah. Great. Amazing tips. We're getting, you guys, I hope you're taking advantage of this because this is amazing tips, things that you should definitely be a private client for Parijat, but she's giving away thousands of dollars in tips here. Make sure to use her shop. I love that it's set up depending on, well, I will just actually bring it up right now because that was our next thing is working with you and what you can offer. Um, okay. So I love the launch of this website. It's
Thank you.
so great. So yeah, where are you on your journey as to what you need? Pregnancy Brain is an amazing book. Highly recommend it. And then of course, yeah, talk a little bit about, so I know that we're going to wrap up soon. Feel free to put any questions in the comments. I'm waiting for those. But like I'm going to be hopping off, you are going to be hopping off this and directly into talking about medical gaslighting, which I'm really excited. So tell them a little bit. I'll pull up the site, but talk a little bit. We talked before, but how someone can become a member and the benefits. Let's see if I can bring this up.
Absolutely. So you can join us, Ruvel, as a free member. You can be a Perks member, and that just means you get discounts to our shop and you get access to free live Q&As that I do every so often, like 10, 15 minute on very specific topics. This week, we're covering medical gaslighting, inspired by really talking about what it is and also what it's not.
Mm,
I think there's a lot of misconception about what medical gaslighting is. I think we're using that term like trauma inappropriately and inaccurately. So you can join us for free at revel.com/perks. And you just get access to, like I said, promo codes for our shop and invitations to our live Q&A and emails from us like once a week about our
mhm.
blog and events happening. And then, as you can see on the screen here, you can join our paid private members club. And that's where a lot of the meat is. So when you come into level 1 and you get to access, basically I've taken everything that I've done with my private clients and have put it into a whole experience for you of what it's like to be in a world that sees you for who you are and your journey, where you get to choose the type of support that you need. Today, you might need some more information. So you might come to our library and check out some of our workbooks or our guides. Tomorrow you come in and you might just need some quiet time. And so you come into our lounge, you put on some beautiful music that we have included in there, and you just chill for a moment in this virtual space. You can come and attend our classes and deeper dive live Q&As that we do in there. We have mixers, like I mentioned before, where you get to meet others who are going through something similar to you in a safe environment where we are not focused on what's wrong, but we're focused on what is possible, and how the resilience factors that you already have built into you can help you complete these threat cycles. So it really depends on the kind of support that you're looking for. The shop is a great place, again, to just dip your toe into some things, grab the book, grab the journal, um,
Absolutely.
rent one of our soothing sessions to test out what somatic work actually is like, and based on the
Yeah.
sensory motor approaches that we've talked about. This is where you would do that, and you can sign up for perks to get those discounts, or come in our private members club. And level 1 is kind of the foundational pieces where we really focus on the foundations, and then you get invited into level 2, where we get to dive significantly deeper into completing those threat cycles together.
Amazing. I am so excited. I'm about becoming a member myself. And also, yeah, so for example, I just wanted to show, I know I showed it in reverse, but just what was up is, so if you want to join in 11 minutes. She's going to start that quick one. So go ahead and join the Perks membership. You'll get an email, and then you'll go in to the to that 15-minute session. And then if you join as a member, there you'll lot others. So like we said, this is kind of this space, this community that all the different rooms with different things. I would be remiss if I didn't really fast bring up my course really fast. So uh, obviously, I highly recommend that you work with Parijat. I work with a little bit different. Some patients, like I said, but not in the pregnancy. Much more in kind of the fertility, like choosing, like what do we do? Do egg freeze? Do we not? How do you just make a basic structure to talk to a provider, kind of like I said. And then my course is much more centered towards medical professionals, although any advocates, anyone who works hand on with individuals can be helpful. So I want to show that because I think that they're both great, and they don't really cross over, but are very good. So let me switch. Whoops. I'm still learning on this, switching the slides within it. For your patients. Okay. So, as probably you guys who have followed me, I was working on the course. It's complete now. So both Parijat and I had, were working hard towards launches. So anyone that wants to learn how to work with patients better and yeah, trauma informed is the ultimate goal, but kind of as far as that says, like this is the start. So maybe I should update it to do, trauma sensitive. But I also do individual clinic trainings to have a lot more hands-on and going into like what you were talking about. Work with clinics and broad perspectives, but my main clients are abortion clinics and OBGYNs. So I think that I love that our work complements each other. We're both like with this goal of ultimately, the trauma informed healthcare. Uh, a yeah, and a really a patient focused and let's see. Oh, sorry. That's why. It it made it to the slides and my screen. So I was like, "There's 3 of me?"
Oh.
Um, but yeah, I was spacing on the term when of that how you specifically were using it of like demedicalizing, but you were using a different word.
Depathologizing?
Yes, depathologizing. Thank you. I was like, we're both here working of like depathologizing and trauma-informed healthcare um, and self medical care.
Yeah.
Let me check. I don't see any other comments. Well, I just want to thank you so much. I want to release you in time to get to your thing and be sensitive of that. Anything else that I didn't ask you about, if you want to talk about you or Val, feel free to.
No, I just thank you so much for having me here. I think if anyone wants to connect further, all our links are at ruvel.com,
Yep.
um, to the shop, to our perks membership, to our private members club. And I will offer that if you want to work privately and you want to schedule a consultation, we do have a referral discount if you come through watching this video. So just let us know that you came through this trauma responsive reproductive health workshop, or you were referred by Lindsay Nelson, will give you $100 off the initial consultation as well.
I love that. Can I do it for myself?
Yeah, absolutely, you can.
Amazing. It is such an honor. I have been wanting to have you on, and I just feel so honored that you gave of your very busy schedule to share. your experience. So thank you so much. This recording will be on LinkedIn, and then I will share it, of course, the recording with you to use
That'd be
as is
great.
helpful for your members, of course.
Amazing.
Thank
Thank
you
you.
all, and happy belated Women's Health Day and Menstrual Health Day. We will see you back in June. In June, it's going to be about, it's going to be on a Monday instead of Thursday because it's going to be the anniversary, the fall of Roe, and we're going to talk about kind of the communal trauma of that. I
Mhm.
think that could be.
So good.
Um, Unfortunately heavy, but I think we wanna focus on, how what we can, find positive and find empowering in the healing and focusing on how like, the solidarity that we've really had, since then. And then in June, I will also have a launch party, to kind of officially launch the course. So, thank you again, Parijat, and, good evening or afternoon or morning for wherever you're at, from Repo Empowerment and from Rubel.